With management of the unconscious patient, it's important to remember the acronym Doctors ABCD, DRS ABCD. The D stands for danger. It's important that you recognize and manage the dangers before you approach the casualty. The R stands for response. It is important that you ascertain that the patient has a response before you proceed. Approach the casualty, ask them, "Can you hear me? Are you alright?" If there's no response, tap them on the collarbone or pinch them in the ear. If they still do not respond, you'll need to move on to S for send for help. If possible, you should use bystanders to get help. Make sure they come back and tell you that they've made the call. If you're on your own, make the call for help yourself now. The A stands for airway. You can open the airway by taking the casualty by the forehead and the chin and tilting their head back as if they're looking at the wall behind them. When an unconscious person is lying on their back, their tongue may fall against the back of their throat, closing their airway, preventing air from the nose and the mouth entering the lungs. By tilting the head back, you can lift the tongue, creating an airway. Once the airway is open, you can start to look for breathing. Using your ear to listen, your cheek to feel, and your eyes to look at their chest, try to detect any breathing. If the casualty is not breathing adequately or not breathing at all, the C stands for CPR. Draw an imaginary line between the nipples. Place the heel of your palm up and down the center of the breastbone in the center of this line. Place your other hand on top of the first, lacing your fingers together to lift your knuckles clear of the casualty's chest. Keeping your arms straight at the elbows, bring your shoulders directly on top so that your arms are pointing directly down into the center of the casualty's chest. Perform 30 chest compressions, pushing the chest directly down, about 1/3 of the chest each time, allowing the chest to fully rise in between each compression. The speed of the compression rate should be roughly 100 beats a minute, or 1.5 compressions every second. Once 30 compressions have been delivered, you'll need to give 2 breaths. Open the airway by tilting the head back as if the casualty is looking at the wall behind them. Place the face shield. With a big mouth, pinching the nose, deliver 2 slow breaths, just enough to make the chest rise each time. Turn your head away in between breaths to avoid any fumes or gases the casualty may have inhaled. Return to the chest, perform another 30 chest compressions at a speed of 100 per minute, a depth of 1/3 of the casualty's chest. If possible, you should consider swapping with another person so that they can perform CPR every 2 minutes. Continue this cycle of 30 chest compressions to 2 breaths until an automatic external defibrillator or AED has arrived, until the ambulance people have arrived and tell you to stop, or until the patient recovers. One of the most common reasons why the chest fails to inflate is because the airway is not completely open. If this occurs, reposition the airway and attempt another breath. With child CPR, the doctor's ABCD acronym is just as important. Danger, response, send for help, airway, breathing, CPR, defibrillation. D stands for danger. Remember to ascertain the dangers in the scene. Take care of them before you approach the casualty. R stands for response. Check for a response the same as you would with an adult, calling out their name if you know it, asking them if they are okay, tap them on the collarbone, or pinch them in the ear. Send for help if there's no response. Remember to use bystanders if they're available. Remember to ask them to come back and tell you that they've made the call. Open the airway in the same manner as the adult. One hand on the forehead, one on the chin. Tilt their head back. Look for breathing by look, listen, feel. Look at their chest, listen with your ear, feel with your cheek. If there's no breathing after a few seconds, you'll need to move on to the C for CPR. Finding the center of the nipple line, place one hand in the middle of that line. Perform chest compressions at a speed of 100 beats a minute, just the same as you did for the adult. Again, compress the chest by 1/3 each time, making sure that the chest rises and falls completely in between each compression. Place the face shield, open the airway, give 2 slow breaths, again just enough to make sure the chest rises and falls. 30 chest compressions at a speed of 100 beats a minute, compressing the chest by 1/3 each time, one hand. If bystanders are available, they should take over from you every 2 minutes, just the same as you did with the adult. 30 compressions to 2 breaths until the AED or automatic external defibrillator arrives, the ambulance people tell you to stop, or the child recovers. The DRS ABCD or Doctor's ABCD acronym applies to the infant just as it does for the child and the adult. Dangers may still be in the scene even with an infant. Make sure you manage them, take care of them before you approach the casualty. Assess for a response in an infant by picking them up, looking for any movement. If there is none, tap them or poke them in the foot, see if you can get a response this way. If there is no response, send for help. Again, use bystanders if possible. If you're on your own, perform 1 minute of CPR before going for help. Open the airway by just opening it a slight amount as if they're sniffing at the air. It's a little smaller than the child and the adult. Look for breathing again. Look, listen and feel. Look at their chest. Listen with your ear. Feel with your cheek. If there is no breathing or the breathing is inadequate, begin chest compressions. Find a spot between the nipple line with 2 fingers, 30 to 2, 30 compressions to 2 breaths, pushing the chest down by 1/3 each time, making sure it rises fully in between. Rescue breathing for the infant is given through the mouth and the nose. Place a face shield over the infant's nose and mouth, open the airway, deliver 2 breaths just using your cheeks, just enough to make the chest rise and fall each time. Continue giving compressions at 30 compressions to 2 breaths at a speed of 100 beats a minute, pushing the chest down by 1/3 each time until an AED arrives, until the ambulance people tell you to stop, or until the patient recovers. With adult and child choking, it is important first to ascertain whether or not the person is choking. Ask them, "Are you choking?" If they indicate that they are choking by placing their hands to their throat or pointing, begin by leaning them forward and giving them 5 back blows between the shoulder blades. The back blows should be delivered with using an open hand between the shoulder blades in the center of their back. If the back blows are not effective at removing the object, turn them around, placing one hand in the center of the chest similar to the CPR position, and perform 5 chest thrusts. If the object has still not come out, repeat the process, turning them around, 5 back blows, 5 chest thrusts. Complete these maneuvers up to 3 times. If it still hasn't come free, call the ambulance and continue until it comes free or the ambulance arrives. Should the casualty become unconscious, perform CPR at 30 to 2 with Doctor's ABCD just as you did earlier. When you realize the infant is choking, pick it up, making sure to support the infant's chin with a C grip. Place the infant down over your knee, with gravity helping to force the object out, and apply 5 firm back blows between the shoulder blades. If this doesn't remove the object, turn the infant over, laying still down on your knee with the head lower than the body. Apply 5 chest thrusts in the same position that you perform CPR between the nipple lines. The chest thrusts are slower but the same depth as CPR. If the object has not become dislodged, turn the child over and repeat the process with 5 back blows followed by 5 chest thrusts, keeping the infant's head lower than its body throughout. If by the 3rd cycle the object has not been cleared, have a look in the infant's mouth. If you can see the object in there, remove it with your finger. If it's still lodged, call 111, get back to the infant as soon as possible, and continue the cycles of back blows and chest thrusts until the ambulance turns up or until the object has been cleared. Should the infant become unconscious, perform CPR at 30 to 2 just as you did earlier.